Hey everybody, it's Dr. Brace here for Facial Plastics Friday. We are back with our facelift series after a little break. I was gone last week on vacation, but I wanted to talk today on what's the difference between a deep neck lift or submentoplasty and a facelift, and what those incisions are and why we do that. And so if you think of a traditional facelift incision being at the hairline, around the ear, underneath the earlobe, behind the ear in the little crease, and then down the hairline, that lifts the cheek, the jawline, and the neck. So that lifts all of this, and that's why that incision goes around there, so that you can remove the extra skin. The length of that incision is proportional to how much skin you have to remove. If you have a lot of hanging skin, that's gonna have to be a longer scar to be able to remove it without creating little dog ears, little areas of skin that stick up. If you picture a carpet, if you cut a circle out in a carpet and you just folded it up, it would make little dog ears, little triangles that sit up, and that's the same thing that happens with a facelift. If the scar is too short and you pull skin, you're going to end up with redundancy that will bulge up as little triangles called dog ears or standing cones. So when we're doing a deep plane facelift, deep plane face and neck lift, you're lifting the cheek, the jawline, the neck. Sometimes though, we need to make an incision underneath here, and that's to address the submentum. This is the submentum. And there's a few structures in here that can only really be addressed through this incision, or best addressed through there. If you have platysmal bands, the bands of muscle that come down here as we age, that can be improved by pulling the muscle back with a facelift, unless they're really prominent. And in general, there's a study that shows that if they're about more than 1.2 centimeters deep, that if you just do this and pull it up, they will recur. They'll come back. And this is the bane of every facial plastic surgeon's existence, is getting these bands to go away and stay away. The tuck-up rate is quite high, where we have to revise this because they want to come back. Gravity wants to let that muscle fall. So even if you lift it up this way and sew it and secure it in place, with time they'll come back, and they'll come back quicker if you don't do something about them in the front. So if somebody has mild banding, they're not very deep, all you need to do is the traditional incision. If somebody has deep banding, or a lot of fat, a lot of tissue, a lot of fullness here, or a lot of fullness from the submandibular gland in this area, this incision lets us both remove the fat, sew the muscle together here, make cuts in the muscle to break up the band and allow it to rotate up easier so that you can get rid of them long term, and to trim the submandibular glands, or the little salivary glands that hang down below the mandible and create fullness here. So you can do a facelift, you can lift everything nice and tight and have a beautiful result and still have a bulge here because of the gland. And that's a normal structure, but if you really want to get a contoured neck, you have to go through a submental incision, trim that salivary gland so that it's flat and flush with the jawline, so that you get a nice sharp jawline structure. This also allows us to anchor the muscle to the hyoid bone to get a nice sharp cervical mental angle, whereas you can't always get that just by lifting from the side. And it allows us to deal with the bands that are lower down, that are sometimes harder to deal with from back here, where you can sew them together. And so in a facelift, if you're just doing a traditional facelift, you're going to have incisions around the ear. If you're going to be doing face and neck lift with submentoplasty, that often involves an incision here, and those are the reasons why. So if you have any questions about facelifts, send them our way. I'm happy to answer them. Everybody have a great weekend, and happy Facial Plastics Friday.